Perhaps Alan Ludell has something in his repertoire along those lines. We will find out right now.
Well, I'll tell you what, if you want
Mr. Gessie will be the first responder.
if you want
on
to do
this.
health care, let's do health care. Please say what parts of the president's health care overhaul you would retain or expand or contract, and why. And sometimes people talk about three parts of the stool. Without individual mandate, how else would you pay for some of the more popular provisions?
Well, first of all, I believe I'm the only candidate who has gone on record to say he will vote to repeal Obamacare completely. There are some good parts of it that we should keep. Congress has the right to regulate commerce, so we shouldn't allow insurance companies to discriminate against people who had pre-existing conditions to get insurance. We should definitely allow kids to stay on their parents' policies longer once they're 26 because they're coming out of college up to their eyeballs in debt and they can't find jobs. But Obamacare institutes 10 new taxes on the people at least, and the majority of them aren't on the rich. We think that we're taxing the rich to get lower health care. I mean, if you look at the bill, there's a 2.3% excise tax on medical devices. That increases cost of procedures. It also increases the cost of the prosthetic limbs that our troops need when they come home, and Congressman Carney did not vote to repeal that when it came up. So there's other taxes as well. You're not going to solve this in 60 seconds, but it is a huge tax increase to the people, and we need to get rid of it.
Thank you, sir. Mr. August, to you.
As a Green Party candidate, I've also had the privilege of traveling the world. The United States is probably the only industrialized country in the West that does not have some sort of universal single-payer health care. The present system is a stone-complete disaster. There are millions of people out of work who have no health care, that need health care. People with existing conditions, because of Obamacare, will have coverage. But this is a stopgap. Now, when they were talking about health care, the public option was available. What they're saying now is the reverse public option, in other words. Like they don't want to have to pay and stay with their high-priced insurance as compared when you could have a public option and have the choice of you want to be on regular Medicare or if you want your private insurance to pay extra for it. But most countries eliminate that, but just have a single-payer Medicare-type system.
That's time, sir. We can obviously expand on this, and
Yes.
I think probably we will in this round. Mr. Kovac.
We have a serious problem with accessibility to health care. I do not believe that providing health insurance is the most effective way, and mandating health insurance is the most effective way to get there. One, it's impractical. We require all drivers to get insurance, but yet so many drivers don't have insurance, we have to have uninsured motorist coverage. We are not going to get there. We're not going to be able to force everybody to buy coverage. As a matter of fact, in this type of an economy, when people are struggling to get by, there are many people that I know Congressman Carney has admitted as well that can't afford that coverage. We are going to be forcing people to buy things that they can't afford to make ourselves feel better that we're covering everybody, that everybody's been mandated to have this coverage. We've had allegations of cost savings when we're really just cutting benefits. We need to make sure that people have accessibility to health care and health coverage. We need to make sure that people with pre-existing conditions who've had insurance can transfer that insurance and add that portability. I like the fact that students in 26 can get on their parents' insurance. That's really ignoring the main problem of why the students need that insurance, because the economic conditions don't allow them to have a job.
Mr. Carney.
The House Republican majority has voted 31 times, maybe up to 33 times now, to repeal the Affordable Care Act. And yet they have no proposals to replace it. And there are a lot of good things in the Affordable Care Act, and some of the gentlemen here have just mentioned some of those, eliminating restrictions on pre-existing conditions, allowing adult children to stay on their parents' health insurance, elimination of lifetime limits for coverage. I have several concerns. The bill is not perfect. It's a huge piece of legislation that involves 16% of our economy. One of the things that I'm concerned about, given my experience on Delaware's Healthcare Commission, is the fact that the individual mandate, we're requiring individuals to purchase health insurance and a certain minimum benefit package, which could require both either taxpayers or those individuals to pay more than maybe they can afford. I think we need to look at that as it is implemented. This is going to be a work in progress. We need to focus mainly on cost containment because it affects our budget like it does.
Let me do this, as opposed to just opening up generally. Alan, hearing what you've just heard from the respondents, anything further, any other direction you'd like to take this?
Well, at least 3 of the 4 of you have indicated that you do like some prongs of the overhaul. But again, I come back to, if you get rid of the economic mechanism to pay for those things, the individual mandate, what do you replace it with?
Well, that's really the bottom line, Alan, is that the legislation kind of holds together as one single piece, because to fund the things that everybody likes, and we hear even Governor Romney saying that he likes these certain provisions, you've got to have funding mechanisms in the bill to cover that. My concern is around those overall costs in the system. How do we maintain costs, keep costs low, while making sure that there's greater access to health insurance? This is the largest expansion of private health insurance in the country's history, and that needs to be clear. There are people that object to the fact that it doesn't really involve a single-payer system or a government option. There is an expansion of a government option, expansion of Medicaid, but essentially it's a huge expansion of private insurance, and that we need to keep that in mind. We need to also keep in mind the imperative for cost containment.
And I agree with Congressman Carney, but I think, as many experts have decided, that this bill does little to contain the actual costs. What it does is distribute those costs, and distributes those costs to society. What we've said is cost containment is important. Healthcare is 1/6 of our economy, but yet we're ignoring the fact that this does not actually address cost containment. Giving people free access to coverage does not encourage them to save money. As a matter of fact, it doesn't even ensure that people have access to healthcare. In Canada, they have access to free healthcare. But yet, we have now a growing number of Canadian patients crossing the border of the United States because they have free healthcare if you can wait the 6 months, if you can survive the 6 months to get that treatment. We need to make sure that our healthcare is affordable. We need to stop doctors from practicing defensive medicine. We need to overhaul our tort system. Giving free insurance to all is not going to solve our problems.
I'd like to offer Mr. Guesty and Mr. August each another minute.
Thank you.
Before we move
I'll
on.
take that minute.
Go right ahead, sir.
Obamacare is the healthcare system for the 1%. All they're going to do is line their insurance pockets with our costs from our pockets. It is not an economically viable way to run a healthcare system. If you're going to have a healthcare system for everybody, then everybody should be able to pitch in for it. But no, it's going to be the insurance companies that are reaping the most benefit out of this, and it's actually mandated profits for them, period. 2, the idea that healthcare is such a burdensome, while maybe the chemical industry and the production industry in this country that's been monopolizing and destroying our planet, poisoning our water, poisoning our air, might get back into a regulatory scheme, on some kind of control regulatory scheme, which will reduce everybody's healthcare costs to begin with. They're just cost shifting the misery onto us people and us consumers.
That's the time. Mr. Guesty, to you.
You asked how we're going to pay for the things that we like in the plan. Well, what happens is the people pay, for that when they buy the premiums. And you have to take a look at healthcare plans that would include the things like no limits on the amount of damages that are caused and things like that. And we have plans like that today. They're called high deductible plans or catastrophic plans that people can buy. The premiums are low, and they stop people from going into bankruptcy if they get horribly injured. We have to take a look at how we use insurance today. I mean, we shouldn't be whipping out our card when we go to the doctor for a sore throat. We should be paying cash for that. Insurance is to pay for catastrophic things when things go bad. If you break your window in your house, you go to Home Depot and you buy a new pane. If the house burns down, you call the insurance company. That's the way our healthcare should be, and it's going to take a while to get there.
I have to say something to that.
Just a moment, sir. We have so many questions and issues to tackle. I don't want to just leave it at a couple. I know we have 4 people. We have an hour and a half. We need to move along.
I have people
Sir?
that have had cancer.
Mr. August, please.
And they are
in
not
the name of the
glasses
format,
window.
let us move along. We've each gotten 2 rounds here. I think we've offered up a fair amount of time on this.